But welcome for those of us that are here. It's really great. We're going to be able to do this. I wanted to thank both Maureen and Erica, who have really been instrumental in putting this together, and make sure you know that Erica and Maureen are a main part of the program that we have at school to try to keep everybody safe and up to date on what's really happening. Maureen has settled into being the person who takes over with cases or potential cases. Some of you may have even already had a contact, well, I don't know. And Erica has done a lot of that as well, but has really focused a lot on the ventilation systems in the school. And I think we're hoping to have a ventilation program like this one next month, I think, on that. And I just wanted to make sure that we were really thankful. I'm being very thankful to both of them for what they've done and helping us, and as well as now tonight, Paul Damaski, one of our parents. And I should say that Maureen is a parent and Erica is a parent. And so we're, you know, it's like sort of the those funny commercials where we're members. We're not just
right.
we're not just here for the good of it. We're members. You know, that's really a good thing. And thank you all very much for coming out. I think I'm going to quickly turn this over to Maureen and Erica, and they'll bring Paul in, and then we'll hear some good information, and then maybe have a little bit of time, I'm not sure, for questions at the end. So thanks a lot for coming. It's great to see everybody, and turn it over to Maureen and Erica.
All right. Hi, everybody. I'm Maureen Santesi Wagner. I have just come on board to the Friends Schoolship, and I'm a registered nurse, and I've been working as a contact tracer for well, since the beginning of the pandemic, really. So putting some of those skills to work here, and just wanted to provide an information session on vaccines for kids as they're coming up here. On the 26th, they'll be reviewing them of this month. The FDA is reviewing them. So we wanted to be able to kind of get ahead of things and answer some questions that parents might have with regard to the vaccines. So I just had a couple of things I wanted to ask, and that was to please keep yourselves on mute during the presentation. If you have questions, go ahead and type them into the chat box. Know that today's session is just strictly on vaccines. It's not going to be on school policy. And when I post the video, I'm hoping to the community, I'm hoping to have a survey that will ask about people's vaccine preferences, and if they're planning on vaccinating their kids, just for planning purposes in the future. It will be anonymous, but we do want to be able to do some planning ahead instead of just reacting. So, yeah, Erica.
Thanks, Maureen, and thank you, David. Like David said, I'm a parent, and I've been working with the pandemic committee last year and the advisory group this year to help advise, and now a little bit more of an active role in the ventilation as well as contact tracing. My background's in public health. I've worked in public health, usually in low and middle income countries, in maternal and child health and nutrition programs. So my training is in public health design and evaluation, and with some epidemiology as well. So thanks.
So Paul, if you would like to go ahead and, this is Paul Damaski, you can introduce yourself.
Yes, thank you so much for the opportunity to speak tonight to both Maureen and Erica, and to David as well. My name's Paul Damaski. I'm a family doctor by training. I work with Geisinger over at our State College Grace Woods Healthplex office on the other side of town towards Port Matilda. Been in there about 10 years. My disclosures is I have no financial implications to the vaccine whatsoever. I do see kids, mostly adults in my practice. I do a lot of women's health. I have a large LGBT population, and I helped start our transgender medical program at Geisinger about 5 or 6 years ago now, maybe longer. I've lost track. I have a daughter, Charlotte, who is in 4th grade at Friends School, and I guess that's my full disclosure here. Maureen and Erica asked me if I could speak a little bit on the vaccine and answer some questions that the community might have. And so I've got a list of questions that people submitted ahead of time, and I'll be able to go through those. And if people have any questions afterwards, they can feel free to reach out to me directly as well. My email is pdamaske, PDAMASKE @yahoo.com. I'm going to be really specifically talking about the COVID vaccine that will be coming out next month for kids aged 5 through 11 is the age group that will be coming out for, and that's the Pfizer brand vaccine. Moderna and Johnson & Johnson are collecting data in clinical trials for that same age group, but they are behind Pfizer. So when the vaccine comes out, which we anticipate it to in early November, it will only be the Pfizer vaccine for kids age 5 through 11. And when there's been some surveys of parents, how they're feeling about giving their kids the vaccine, about a third are really excited. They're going to be at the front of the line. A third are like, probably I'll get there sometime. Quarter-ish are no way in heck. And maybe there's like 10% on, I'm not quite sure. And that's a national survey, so I don't know how we are in State College or Friends School, but that gives us a little bit of sense of where we are as a country. And why do we care? Well, kids get COVID, and kids can give adults COVID, and adults can give kids COVID, and vice versa. So most of my data in this little talk is based on some data that's maybe about a month old. So at that point, about 5.5 million kids in the United States had been diagnosed with COVID-19. That's positive tests, and so they're probably a larger group that were not diagnosed officially on the numbers. Since the start of the pandemic, now a good quarter of those cases were just in the last couple months alone with this Delta wave, and so the Delta wave really hit kids pretty hard in terms of numbers. One of the questions I got beforehand was, well, how does COVID affect kids compared to adults? And so the good news is it still seems to hold overall that COVID illness for kids, when I say kids under 18, is generally fairly mild and oftentimes asymptomatic. So some kids can have COVID like some adults and can have no symptoms whatsoever. However, there is a wide range of asymptomatic to lots of really severe symptoms and even death. So that's where COVID as a disease, I think, is so unique and also frustrating and quite honestly scary as a parent and as a medical provider. So far, we know there's about 500 deaths of kids in the United States since of COVID. So not a very large number compared to the number of cases, but there have been tens of thousands of hospitalizations of kids due to COVID illness, including thousands on life support in the ICU through the course of their illness. So not very many kids die, but we still are talking tens of thousands of hospitalizations of pretty sick kids. I think this data is about a month old. About 4,600 kids have been diagnosed with some of what's called a post-COVID syndrome that's quite severe, called multisystem inflammatory syndrome in children. You may see the acronym MIS-C to delineate it from the adult post-COVID multi-inflammatory syndrome. So the C is for children. And that causes inflammation of multiple organ systems, including heart, lung, brain, kidneys, and other organs. So there are very potential serious outcomes of COVID infection. We know for adults that post-COVID, about half of adults report post-COVID milder symptoms, but even the milder symptoms can be pretty severe. A lot of neurological symptoms, especially. Everyone's familiar, well, I think most people are familiar that COVID can often cause loss of sense of smell, loss of sense of taste. It affects the nervous system in lots of different ways. A lot of what I see in my practice is fogginess, really a lot of mental challenges post-COVID for a lot of my patients, and mood and anxiety changes that we don't quite know how that's affecting the brain, but the virus does certainly seem to infect the nervous system, and that can range from anxiety, depression, to even suicidal thoughts in some patients. How is COVID doing in State College? Some of you may be checking the COVID trackers more often than I am, but when I looked at it this week, the numbers are, fairly stable. I would say in the last couple of weeks, I've seen Eric and Maureen, I would say in my practice in town, we are starting to see a little less diagnosed in State College, but our surrounding towns are remaining quite high. And the surrounding counties around Center County are extremely high still. So, I'm hoping there's a little light at the end of the tunnel there, and maybe we're starting to see it. I'm going to knock on wood, but we're still quite a bit of prevalence in the State College area. And unfortunately, of course, as many of us have heard, the variant that is the predominant one now, Delta, is extremely contagious. We're talking chickenpox levels. So I think almost all of adults on this call probably had chickenpox as a kid. So that's how contagious COVID Delta form is. One of the other questions that I got was, how spreadable is it from children? And we didn't have a lot of information on that early on. And so that was actually a big question, is like, could kids spread it? Or if they can, is it very contagious? There's still not really super clear data. And so from what I was reading, putting things together, kids can definitely transmit it, although it seems like probably to a lesser degree than adults. A lot of the studies kind of have complex data, meaning maybe it's not quite clear. One Canadian study suggested that younger kids are actually more likely to transmit the virus in home than kids. But another study in Israel showed that kids 10 and under are not very likely to spread it in a school setting. So I don't think we've quite figured that out yet, honestly. We do know for certain they can, especially in the home. And that's where we're seeing a lot of like the intra-family spread here in town, and in the larger studies as well. And so, we can extrapolate that in a school that it has the potential to spread to. And thank you so much to the COVID team for making that less likely with all our ventilation, which I'm excited to learn more about on our next talk. How effective are the vaccines? So far, the data on kids has been really quite good, especially as an adult. In terms of preventing hospitalization illness, the very serious illnesses, it's been amazingly effective. And frankly, I think more effective than any of us were even dreaming about a year ago. It is not 100%, nothing is, but I can tell you with Geisinger, we get a dashboard every day of how many people are in all our hospitals across our system, how many people have been vaccinated versus unvaccinated. And we're running pretty steadily around low 90s of the percentage of people hospitalized and in the ICU and intubated were not vaccinated. So some people were vaccinated. It's hard. I don't have the data on how many of those people have underlying conditions, but generally speaking, the vaccination is extremely effective at preventing both severe and milder illness. And of course, we know that if we have less people getting infected, kids will protect adults and adults will protect kids, and vice versa. I thought I'd speak very briefly on how the mRNA vaccine works. I'm sure a lot of us have read about it already, but since this is what the Pfizer vaccine is, that's coming out for kids real quick. Why do we use that? and what side effects could that have on kids? And what side effects do we know that it's had in adults? Because it's been in adults now for quite a while now. So they've been working on mRNA technology, which is the type of vaccine that they've been using for about 20 years now. Is when they first kind of came up with the concept, and they've been using it on other vaccine trials as well, dengue fever, for example. So when we were able to get the actual gene of the coronavirus, can't think of the word, but basically they mapped out the gene, and they were able to plug that in pretty much instantly into the vaccine, and then the full force of the CDC and the vaccine part of the government was able to ramp up trials. And so the trials that were done with the same number of patients as they typically were. They were just done, they were able to do it quite quickly because people were very excited to enroll, and the government really funded it to the hilt in terms of getting scientists and hospitals and everybody on board to make the trials happen as quickly as we could. And so they followed the patients through phase 1, phase 2, phase 3 trials, larger groups of people each time, and saw the safety data and the effectiveness data. And so here we are. Kids, the companies did those trials slightly behind the adults, which is why we're only now rolling out the children several months later post adults. The CDC also asked the pharmaceutical companies to expand the number of people they were enrolling in the trials as well, to try to get a little better sense if there were any rare side effects that they could tease them out at an earlier stage during the trials. One of my questions was on mRNA. So you get the vaccine, it goes into your arm, and then it signals your body to make these little spike proteins, which your body makes the antibodies to, and that's how we fight it off. So one of my questions was, well, what happens with that mRNA? Like, does that stick around? Does it stay around? Does it keep telling your body to do this forever? So it turns out no. I guess pretty much all vaccines, your body actually breaks down in a relatively short amount of time. Most of the vaccine does stay in the muscle that's injected in, and some of it actually gets into your lymph system, which helps your body's immune system kind of process it. It's fairly localized, so we don't think it's actually building up in any organ systems. And then your body breaks down the mRNA into small harmless pieces. It's really fragile, the mRNA. That's why the vaccines are such a pain in the butt to ship and to store. We have to store them at ultra frozen temperatures. And the estimate is that the mRNA is broken down actually very quickly within just a few days. The spike proteins that your antibodies make last about a few weeks. And so that's when your body is learning to recognize these spike proteins and make antibodies to it. That's a few-week process, which is why it takes a few weeks for your body's immune system to react to the vaccine. So you're going to get a first shot with the Pfizer and the Moderna, and you're going to get some protection over a couple of weeks as your body makes antibodies. And then with the Pfizer, the way they designed the trials is that you get a booster shot at 3 weeks to get a much larger response in your immune system, which is why when side effects happen, they're a little bit more common in the second shot than the first for most people. Not everybody, but for most people, the second shot gives you a little bit more side effects than the first, because your immune system gets a much more robust effect. Let's see what else. Just going through some other questions that people had. Can COVID change your DNA? I thought that was a really good question. It does not, thankfully. The mRNA, and I had to go back to my maybe middle school science class to think about this when I made my models of cells out of aluminum foil and Jello. So mRNAs do their works outside of the nucleus. So they never actually penetrate the nucleus into the DNA. The cell breaks down and gets rid of the mRNA after it finishes processing its instructions in the cytoplasm. So it never actually gets into the DNA. So I thought that was a really good question. So I mentioned side effects earlier. So let's talk about that. So very common side effects: pain, swelling, redness. And when I say very common, I actually don't have the exact data right up, although I was looking at it on the CDC website yesterday, so it is really easily available. Probably, I think it's like 20+% of people can get a fever or chills. That's not uncommon. Up to 70% of people will get some soreness right at the injection site. Many of us have just gotten through our getting our flu shot, and I was like, oh yeah, it's a little sore for a day or two. COVID's kind of the same. Some people it's really sore. Some people it's not sore at all. So there's a wide range of reactions. Headache, I think is about 1 in 5 people can get a mild headache on the adults. Fatigue, feeling kind of tired, just a little run down, maybe for a day or so. That's especially more common with the second dose. And then just muscle joint pain. Some people feel pretty achy for about 24 to 48 hours. Not the majority, but some people do. All of these side effects are typically considered pretty mild and typically resolve within 24 to 48 hours. Can you take ibuprofen or acetaminophen? There's a lot of back and forth for quite a while about that. The consensus now seems to be we don't recommend pre-medicating, like giving your kid or adult Tylenol or Advil before the shot, because there is some evidence that that may dampen your immune system a little bit. However, if you get a fever or you feel super achy after you got the shot, then it seems okay to take Tylenol or Advil, ibuprofen. That does not seem to affect your immune system. So right now we're saying not before the shot, but afterwards, if you need it, sure, seems okay. And so I have no problem telling my patients to go ahead and take some Tylenol or Advil if you're feeling super sore. Lots of liquids, stay hydrated, totally allowed to get some extra rest. If you're really sore on the injection site, some people even get some redness. Ice pack can just help bring down some of that swelling, soreness. More serious side effects. We were talking a little bit about this right before some people signed on, so I want to make sure I kind of go over this again. A lot of us have heard about reports of adolescents, especially boys, getting cardiac inflammation called myocarditis. Myocarditis is an inflammation of the heart muscle itself. So just like when you're feeling achy all over and your muscles are achy, your heart is a muscle too. And so myocarditis is actually not that unusual with any viral infection or even vaccine for that matter. It's not like super common, but it can happen. So what they found with both the Pfizer and the Moderna is that you had a slightly increased risk of myocarditis. And I was just pulling up the data as of a month ago. They think the risk of it, or the rate of it, after the second dose, it was 162 cases per million doses for healthy boys aged 12 to 15. So you could kind of do those ratios in but it's easily less than, well, I don't know, it's 162 per million for ages 12 to 15. It's a little less for kids who are slightly older. Girls, it was actually almost non-existent. It was 13 per million. The one important thing to know about the myocarditis cases of vaccines is it tend to be pretty mild. It causes chest pain or discomfort, and it typically goes away in a day or two, just like all the other vaccine symptoms. And it's very treatable, typically with anti-inflammatories. Some kids were hospitalized and were treated there, supportive care, anti-inflammatories as well, and did well. Also super important to know is that COVID disease itself causes myocarditis at levels higher than the vaccine rates. So a lot of us as parents are trying to, the weigh the risks and benefits and trying to figure out, is this a good thing? Is this not a good thing? To me, in terms of myocarditis, it's clear right now, especially on the data that we have for the teenagers that are out there, that the risk of the disease itself is much higher for myocarditis than for the vaccine itself, but the vaccine is not a zero. So 162 per million. Let's see what else. how much, I'm just kind of looking through some of the data that I'd written down. I guess the myocarditis risk from having COVID itself is actually 37 times higher than from the vaccine. So to give you a little bit of comparison. What else did I have on here? Oh, thanks, Erica, for doing the math in the chat. What else? There's a lot of questions about, could it affect fertility? And I think that is a really excellent question, because a lot of people noticed after they had the shot that their menstrual cycle was thrown off. And that was not something that was really well tracked at all in the vaccine studies. So there's a lot of talk about, well, maybe we need to be looking at this stuff with vaccine studies, which I definitely agree with. Dr. Jen Gunter, who's an OBGYN who does a lot of writing on medical issues. She used to write for the New York Times, now has a blog called The Vagenda, has a really good article on this. And reading through her stuff as well as some other things, that just because the vaccine affects the menstrual cycle, may affect the menstrual cycle for some people, it does not mean fertility is affected. Vaccines, no vaccine known affects fertility. The way it works with your body, may, as your body kind of makes your immune reaction, does seem to throw off for some people the endometrial lining, but it does not accumulate. It does not have any cytotoxicity. It's not like a chemotherapy drug where we're actually killing off cells of the ovary. That's not how it's thought to affect the menstrual cycle. What else is good to know about that? Oh, and in the studies, lots of people became pregnant. Lots of people had normal deliveries. They've done a lot of studies, looking at vaccine side effects in pregnancies. And so there's no increased rates of miscarriages or fetal death or other serious effects in vaccinated versus unvaccinated women. So I think that's actually really critical to know, and which is why the CDC a few weeks ago came out really strongly and said that vaccinate pregnant women or women who are contemplating pregnancy are highly recommended to get the vaccine. Let's see here. I'm going to go over to my question list again, just to make sure I'm hitting everything that parents wrote in about. So we talked about the risks. Do I plan to vaccinate my 5 to 11-year-old kid? Yes, I do. In case you hadn't quite gotten that sense from the talk so far. Yeah, as soon as it's available, we're going to try to get Charlotte vaccinated for sure. I definitely think the benefits outweigh any risks, and there are many benefits that I don't necessarily think I need to go into right now about getting our kids vaccinated. Health, seeing other kids, potential for travel again. Let's see what else. Are there conditions when you wouldn't recommend your kid to get vaccinated? That's a really good question. There are some very specific reasons why you should not take the Pfizer shot. They're really rare. I haven't had any patients run into this. Well, actually, one patient. So one of the ingredients is polyethylene glycol. What is polyethylene glycol? Polyethylene glycol is in a ton of stuff. But in terms of medications that many of you may be very familiar with, it's the main ingredient in Miralax, a laxative. It's very, very water absorbent, which is why it works for laxatives. It kind of brings water into the intestines and helps push the poop out. They used it as a stabilizer for the mRNA in this. And there is thought to be a chance that some people could have an allergic reaction to that if they are allergic to polyethylene glycol. I actually don't know anybody who's allergic to polyethylene glycol, but I'm sure there are some people out there. So if you know you have an allergic reaction to Miralax, or an allergic reaction being like hives, anaphylaxis, then you definitely would not want to use the Pfizer vaccine. I believe the Johnson & Johnson does not have polyethylene glycol, but I'm not gonna, don't quote me on that one yet. You also don't want to get the Pfizer vaccine if you've ever had a reaction to it, which obviously for our kids, they haven't had it. But if you get an anaphylaxis reaction, throat swelling, lip swelling, severe allergic reaction, hives all over, then you would not want to get the second booster shot. Those reactions are all really, really rare. I had one patient get hives with the adult patient get hives after about an hour after the Pfizer shot. And so for her second shot, she did not get the Pfizer. She did get the Johnson & Johnson without any problem. So we're not sure. Was she allergic to polyethylene glycol? Possibly. Was she, hives can happen for lots of different reasons. Stress reactions can cause hives. And so was it a stress reaction just from going through the whole process? Possibly, we don't know. But any severe reactions, anaphylaxis or severe hives, you would not want to get the second shot. If you've had a reaction to another shot before, that does not mean you have a contraindication to the Pfizer shot or any of the COVID shots. Vaccines are pretty specific on that. So even if you've had anaphylaxis to one shot, it does not mean you can't have the Pfizer shot. But if you did have anaphylaxis, you'd probably want to talk to your doctor and just make sure you're monitored really well if you do get this different vaccine. Will kids' ability to get infected and transmit be lower within the first 3 months of having both vaccines? So the answer to that is yes. So you get some protection after the first dose. 3 weeks later, you're going to make some more protection, which starts to peak about 2 weeks after that. So 2 weeks after your second dose is kind of when you got the good protection. Do I think kids will need a third dose? We don't know. But my guess would be maybe. Kids' immune systems are better than adults. That's one of the reasons why, I didn't mention this earlier, the dose of the vaccine for the Pfizer for these kids that we're talking about is going to be 1/3 of the adult and teenager dose. Kids' immune systems rev up better with less stimulation. So we don't know how long lasting their immunity is going to be. We just don't have that data at this point. You know, if you really twist my arm, I'd say it's probably going to sort of be like a flu shot that we get every year as they tweak it just a little bit every year, but that's really just me guessing at this point. Other really good questions. What if your kid had COVID? You know, should they get the vaccine? And if yes, how long afterwards? The answer is you will get some protection after getting COVID disease. You will make antibodies, but we don't know how strong those antibodies are, and we don't know how, well, we have a sense of how long they are lasting, and they're not lasting super long, unfortunately. So in my practice, I'm actually already seeing cases of people getting COVID last winter, December-ish, January-ish, who did not get the vaccine, who are now getting COVID a second time. So the data that's out there in terms of COVID antibodies show that they tend to really last pretty well from natural immunity for about 6 months if you make them pretty well, and then they start to taper off after 6 months. Think of it like the flu, think of it like other cold viruses. You know, there's reasons why they come around every single year is because we just don't keep our immunity up very strongly with natural immunity. It doesn't stay up very long. And natural immunity can vary quite a bit for some people. Some people make super strong antibody levels. Some people just don't make very much antibody levels after a particular infection. So the natural immunity can really vary from person to person. So yes, is the short answer is I would recommend getting the vaccine even if you have had COVID. How long after? I don't think there's great data on that. I did check the CDC last night. They said basically as long as you're out of the acute illness, meaning 10 to 14 days after being sick, it would be safe to get the vaccine. I think it's reasonable to wait maybe a month. Some people are even talking about 2 months, 3 months afterwards because of the idea that you will have some natural immunity before you need a boost. I think a month is what I'm hearing from a lot of my colleagues. Seems to be a little bit of a consensus on what we're telling our patients, even though I don't think there's a whole lot of data on that, to be frank. Let's see here. Yeah, and I think those were most of the questions. I don't know if anybody had any questions they want to put in the chat. I think Maureen mentioned briefly the time frame we're looking at is the FDA is meeting at the end of October to go over the data on the children's vaccine studies. So that's when a lot of the data is going to be made public. And then the CDC will meet on the 2nd and 3rd of November to go over the FDA recommendations and to make their own recommendations and changes. And then what happens? Well, the New York Times had an article that, the government is sort of thinking it's going to roll out nationally a little different than adults. Like instead of massive vaccine centers, it's going to be a little bit more in your pediatrician or family doctor's office, maybe a little bit more at the hospital. They are letting the states decide again. And so Pennsylvania Department of Health, I am not in those meetings, so I can't tell you exactly what's happening, but some of my colleagues are working in meetings with Center Volunteers in Medicine, working on meetings in the hospitals. And locally, it sounds like Center Volunteers in Medicine is planning to do some larger vaccine drives again for kids in this age group, which is great. They've been working really closely with the state on vaccines. Geisinger, I can speak for off the record, I guess, since it's not official, but I think we are actually going to be doing the same larger vaccine drive sites that we had for adults. So locally, that means at our hospitals, which is not State College, unfortunately. It's Jersey Shore and Lewistown would be the closest ones, and then Geisinger, Danville, Bloomsburg, and then Pittston out towards Scranton. I think we will be opening up some larger sites. There's some talk about Lewistown. Yeah, Lewistown is part of that. So Jersey Shore and Lewistown. I know our pediatrician department and family medicine department are trying to get pharmacist support to do some Saturday vaccination drives in November. That is not, I'm not sure how if that's going to happen or not, but we're hoping it will. By January, we are hoping to have it in our clinic offices. So it could be just given like a flu shot or a shingle shot or anything like that. I'm not sure what the other groups in town are doing, Penn State or Mount Nittany. I'm sorry, yeah, Penn State or Mount Nittany. I suspect Mount Nittany will be doing vaccine drives again, similar to what they did for adults, but I don't have confirmation of that. And I think that's the time frame. Erica wrote in the comments questions. Someone asked about flu shots. Oh, great. Yes. So yes, you can get both the flu shot and the COVID shot at the same time. Way back at the start of the pandemic, we were like, oh, we don't really know. Let's separate the vaccines just a little bit to make sure nothing crazy happens. And so the COVID vaccine behaves like any other vaccine. It boosts your immunity. You're going to feel achy. Totally fine to do it with another vaccine if you want to. So if your kid hasn't got the flu shot and it's set up to do both, I don't know if the vaccine sites will be set up to do both. I don't know that answer. So if you have that option to do both, you sure could. Now is a good time to get your flu shot though, because October is kind of a sweet spot in terms of preventing flu for the spring. So what else? If a child already has had COVID, is 1 or 2 shots recommended? Super great question. So if you have COVID, you get some antibodies, you get a shot. This is in the adult data, you get super antibodies. So probably more than anybody else out there. So my answer is, I don't know if we have super great data on COVID plus 1 or 2 vaccines. Erica or Maureen may actually know better than I do. The official recommendation is still to get the full series. And one person actually had, I'm forgetting one question. One person had asked a question, is there some benefit in delaying it beyond the official 3 weeks booster? I don't think we know is the data on that. On the AstraZeneca vaccine, which is one of the main ones they've used in Europe, there was some good data that on their trial that giving a delayed booster of several months seemed to give a more of a protective effect, but I don't know that we have good data on that for the Pfizer Moderna. There is some hypothesis that longer may be better, but I don't think we have very strong data on that point. I think as we accumulate all this data over the next couple of years, they certainly might start changing that to beyond 3 weeks for the second dose, but I don't, to my knowledge, we don't have very good data on that yet. So I think that's all the questions I had. And so I'll just give my email again in case anybody wants to email me questions. I'm happy to write anyone, pdamaske, D-A-M-A-S-K-E @yahoo.com. And thank you so much to Erica, Maureen, and David for inviting me again. I really appreciate the opportunity.
Oh, thank you so much for joining us. This has been amazing, so informative, and I'm just really grateful for your time. Thank you so much.
I'm happy to be here. Thank you
Great.
for all that you guys do.
Thank you. Have a great night, everybody.
Thank you. Have a good night now. Bye-bye.
Thank you, Paul.
Thanks, Dr. D.
Thank you very much, Paul, and thanks everybody for coming. It's fantastic.
And I'll stick around if anybody wants to stay.